we need to understand the prolactin hormone. See, there is also prolactin, yes or no? See here, prolactin. See, firstly, we need to understand the prolactin. See, prolactin is a peptide hormone secreted by peptide means it's basically the bond within the protein, right? Within the amino acid, there should be present the peptide, right? That is a peptide secreted by the lectotroph cell of the anterior pituitary gland. So that prolactin basically secreted from the anterior pituitary. Understood? And into our pituitary, there have two types of pituitary, right? One is anterior and another one is the posterior pituitary. Anterior pituitary, that is basically in front of our pituitary, that is the anterior pituitary. After that, posterior pituitary, that is the behind our pituitary, that is the posterior pituitary. Anyone can say me that into the posterior pituitary, two hormone basically secreted from the posterior pituitary. Anyone can say me the name of this particular hormone? What are the hormone basically secreted from the posterior pituitary? Anyone can say? There have lots of hormone into the anterior pituitary, but only few hormone under the posterior pituitary. Say me, what are the hormones name which is basically present into the posterior pituitary? Say me.
Oxytocin and ADH.
Very good, very good, very good. Oxytocin and ADH. ADH defining antidiuretic hormone, right? It basically maintain the urination into our body. Okay, okay. See, so that into the diabetes insipidus patients, the ADH hormone are not secreted properly, right? See, now we are coming to the function of prolactin. See, this prolactin basically help to stimulate the mammary gland. Mammary gland basically found into the breast of the female. Okay, and whenever these prolactin are present in a normal amount, or the desired amount of prolactin should be present into the mammary gland, they basically produces the milk during pregnancy and postpartum. Okay, after that, regulate the immune function. Okay, with interacting the lymphocyte and other immune cells. Understood? After that, play a role in the metabolism by influencing the insulin sensitivity. Understood? Whenever the insulin sensitivity you have to maintain, then metabolism should be occurred into a proper way. Understood? After that, influence the reproductive health by regulating the gonadal function. Gonad defining the reproductive organ. Understood? Gonad always defining the reproductive organ. So that the basic function of the particular prolactin is first one. Okay, that is the most prominent function, as well as that is the first and foremost function of the prolactin. Understood? That is the first and foremost function, okay, to producing the milk during pregnancy. And you will understand, as well as you might see, as well as you might face the questions in the section of anatomy and physiology, as well as clinical biochemistry. In both sections, you might face the question regarding hormone. Okay, so then hormonal tests are too much important. See, now I am coming to the purpose. See, it evaluate, or as well as it help to identify the condition related to infertility. Infertility defined that the women have not capacity to fertile. Okay, as well as the men have no capability to fertile. That is infertility. Okay, after the menstruational irregularities, that is also one female regular cycle or periodic cycle, or we are saying that menstruational cycle. After that, galactorrhea, these kinds of symptoms might be occurred. After that, to diagnosis the prolactinomas, means pituitary gland producing the prolactin high. Can anyone say me if pituitary gland size become increases, hormone secretion become increases or decreases? Say me. That is a tumor, right? Tumor means size of the particular pituitary gland become increases. I am saying you some small tricks regarding the hormone. Whenever you might see the tumor of the particular gland, then hormone secretion should be always increases. That might be pituitary, that might be adrenaline, that might be any other gland. Always please keep in mind that whenever the tumor basically occurs, tumor means size of the particular gland become elevated. Whenever the size of the particular gland become elevated, then the secretion of the particular gland become elevated. Understood? Always please keep in mind that whenever the tumor are occurring, then secretion should be increases. Okay, and tumor is proportional to the secretion to the particular gland. Understood? And another thing, see here, anuria defining absence of menstruation. Whenever the menstruation cycle are not happening properly, that is called amenorrhea. Okay, that's all are the purpose. Understood? After completing the things, I will ask the questions, as well as I will listen your doubt. See, after that test methodology, I have already told you that there is basically chemiluminescence immunoassay. Into the cilia, we have to do these kinds of procedure, and cilia is a automated machine that's basically found into the biochemistry laboratory. Okay, so that you have to, whenever you have to do the test, just put it the particular sample to the cilia machines and on it and program it properly, you will get the proper result of the particular things. Okay, that's all are the test methodology. Now I am coming to the normal ranges. Normal ranges for female, that is a 4 to 23 nanogram per ml. Into the male, that is a 3 to 15 nanogram per ml. Into the female, their amount is high, right? And into the male, that amount is low. Okay, see here, clinical significance. Keep in mind that clinical significance defining two ways. One is whenever it's elevated, which kinds of symptoms might be occurred, or whenever it decreases, which kinds of symptom might be occurred. That is called clinical significance. Understood? So that whenever it increases, that is called hyperprolactinemia, and whenever it decreases, that is called decreased prolactin. Understood? So that whenever it increases, see, prolactinomias means it defining that the benign tumor are happening into the pituitary gland. I have already told you that whenever the tumor are occurring, then hormone secretion basically elevated. After that, hypothyroidism means thyroid hormone secretion become decreases. Okay, after that, PCOS, polycystic ovarian syndrome, nowadays it's basically 70% women are suffers in PCOS or PCOD, right? Firstly PCOS, after that whenever the PCOS are severe in amount, that is called PCOD, right? In the women, that is a, if you are searching into your surrounding, 70% of your women or 70% female candidates are basically suffering into this cystic disease. Okay, you have to choose and right now which kinds of lifestyle you are leading, so that you have to change your lifestyle to decreasing this kinds of disease condition. Understood? And whenever you are changing your lifestyle, the most prominent cause of PCOS, that is the lifestyle changes, or that is a bad lifestyle. Whenever you are changing the lifestyle, means you have to take the healthy foods, you have to avoid the fast food, you have to take in the water in the particular steels bottles, and have to avoid the plastic bottles, as well as you have to maintain your hygiene, as well as you have to maintain your menstruational health, as well as the reproductive health. These kinds of things basically help to prevent the PCOS or PCOD. Understood? After that, stage or exercise, see, and decreases whenever pituitary gland dysfunction are occurring. Pituitary gland dysfunction defining that when the pituitary gland are not occurring properly. So that if the pituitary gland are not occurring properly, means pituitary glands are not occurring properly, means functions are not proper, so that the particular hormone become decreases. That is a very normal as well as easy concept, right? After that Sheehan's syndrome, postpartum pituitary gland necrosis, means whenever pituitary glands tissue become dead, the tissue that is called necrosis. And whenever you have to just extract out to the particular tissue, that is called postpartum of the pituitary gland. So that whenever the pituitary gland size become decreases, see, if the pituitary glands were like that, but you have to just decreases the particular size of the pituitary gland, then what will you do and what will you get? The hormone become decreases, right? Because we have understood that whenever the size become increases, hormone become increases. Whenever the size become decreases, the hormone become decreases. Understood? That's all a related thing about the prolactin. We have understood that what is prolactin. We have understood that what are the function. We have understood that what are the test methodology. We have already understood that what are the normal ranges. We have already understood that what are the clinical significance. Okay, that's all things we have already understood regarding prolactin. Okay, understood up to this much? Any kinds of problem up to this much? Just say me. Anyone facing any kinds of problem regarding prolactin? Just look down upon this table. That is also the same table. Just look down upon the table. That is also the same table. Whatever we have already understood. Just say me. Anyone facing any kinds of doubt up to this much? বুঝতে পারছো কি? আর এই গেটটা কিন্তু লাগিয়ে রাখবে। কুকুরটা এখানে বসে এখানে বসে ওখানে বসে ওখানে বসে মাথা খারাপ করে দিবে। যখনই আসবে গেট লাগিয়ে রাখবে। ওকে ঢুকতে দেওয়া যাবে না আর। দেখো এই কি অবস্থা করেছে ডাস্টবিনটা। Okay, say me. Anyone have any kinds of doubt up to this much regarding prolactin? Are you listening me properly? Are you listening me properly?
Yes, sir.
Okay, say me. Anyone facing any kinds of doubt up to this much? Whatever I have already explained to you regarding prolactin, right? That is the smart strategy to understanding the whole things within a small type of lecture. Okay, if you are doing any kinds of PhD regarding prolactin, that is a very bad things. You need to understand the basic idea regarding prolactin, not only prolactin but also every hormone. Say me, so that can I move? Everyone understood? Mashina is there?
Yes, sir.
Okay, understood.
Yes, sir.
Okay, now we are going to understand about the luteinizing hormone, that is LH. Luteinizing hormone, male hormone or female hormone? Say me, male or female? First, say me, male or female? Luteinizing hormone basically female hormone, right? Luteinizing hormone that is also secreted by the anterior pituitary gland. Okay, it is also essential for regulation and reproductive system, both male and female, but especially that is the female one. Okay, see what are the function of luteinizing hormone? We need to understand into the same procedure or into the same protocols or into the same methodology. We will understand every hormone. Okay, just give me a little bit time, just a second. Okay, see, function of luteinizing hormone is firstly stimulating the ovulation in the female by triggering the release of a mature egg from the ovary. So that when anyone are asking you the question which hormone are helpful regarding the ovulation, what will you say? You have to say that luteinizing hormone. Okay, first. Second, it basically promote the production of the progesterone in female. Understood? And third, stimulate the leading cells that testes to produce the testosterone in male, so that into the male they basically help to evaluate as well as increase the function of the leading cell. And whenever the leading cell will function properly, then testosterone production will happen properly. Understood? That's all are the functions. Okay, that's all are the functions. Firstly, it basically help to make ovulation. Secondly, help to increase the production of the progesterone. And thirdly, into the male, that basically help to produce the testosterone properly. Understood? Now that is the function as well as purpose. See, purpose means always keep in mind that whenever you are understanding any kinds of hormone related to the gonad or related to the reproductive system, please keep in mind that first function should be or first purpose should be fertility, to access the fertility in men and women. Understood? And if it's especially female hormone, there should be present 3 or 4 types of natural function. See, menstruational function, so that you have to investigate the proper menstruational irregularities. If the irregularities are happening, then the production as well as then the luteinizing hormone are not proper. Okay, after that you have to understand the ovarian function by the maintaining the level of LH. Okay, after that you have to diagnosis the PCOS by this hormone. Okay, PCOS or PCOD is not any particular diagnosis. You have to do USG. Okay, so that you can understand the cystic condition. Okay, so that here basically into the luteinizing hormone, that's all are the purpose. Okay, and see here, that is the test methodology. That's all are immunoassay, right? I have already told you that every kinds of hormone are doing into the immunoassay or into the procedure of immunoassay. And whenever I will discuss with you the immunoassay, that is a cilia or islia, then you will understand it how it's basically happening. Okay, but right now you need to understand only the only the name of immunoassay, right? Okay, after that, I am coming to the normal range. For women, there is a two phase. One is follicular phase and another one is the ovulatory phase. Whenever the follicles are developed properly, then its level is 1.9 to 12.5 international unit per liter. If it's ovulatory means when the ovulation are occurred or ovulation will be occurred that into this condition, that is the 8.7 to 76.3 international unit per liter. Okay, into the male, you might see that how much level is low. So that I always say that it's a female hormone or it's the woman hormone. I always say you that because the men, you might see that how much low level basically present within the men. So that we can say that that's all our woman hormone. See, now we are coming to the clinical significance. See, increased level means whenever the luteinizing hormone increase, then might be causes the menopause. Menopause means ending of menstruation, right? Ending of menstruation, that is a menopause. After that PCOS, after that gonadal failure. Okay, and decreased level defining that pituitary gland dysfunction. I have already told you that pituitary gland dysfunction defining the lower level of the particular hormone. And hypothalamic disorder, I am saying you one thing that this pituitary hormone, this uppermost portion of the pituitary hormone, there should be present the hypothalamus, right? Into the pituitary hormone, they basically control the whole kinds of hormone, and this pituitary hormone giving that this hypothalamus basically giving the signal to the pituitary hormone to secreting the hormones properly, right? So the hypothalamus, if any kinds of disorder are happening related to the hypothalamus, then hypothalamus will not giving the signal to the pituitary gland, then pituitary gland will not secrete the hormone properly, so that it is also decrease the luteinizing hormone. Understood? Now if you are watching the PPT or watching the PDF here, or if you are seeing the things, see, one thing you have to notice that after completing every hormone, there should count a table. If you are memorizing this table, it's enough for you all guys for your competitive exam or for your any kinds of examination. Okay, as well as for your biochemistry purpose also. Just look down upon the table. That's enough for you all guys related to the luteinizing hormone. Okay, see the whole tables defining the luteinizing hormone, whatever I have already told you. Say me, any kinds of problem related to luteinizing hormone? Are you really understanding the things, how it's happening? Are you really understanding the things?
No,
Anyone?
sir.
regarding luteinizing hormone? Toiba is there? Toiba have joined or not?
Yeah, I'm joining, sir.
Open your camera. Where are you right now?
Now I'm inside the lab, sir.
Uh, Inside the lab. Okay. Why
Yeah.
it's late?
Sir, today I have some busy, sir. I cannot
Okay.
participate in time, sir.
Okay. Related to your work, right? Okay.
Yeah,
Any
sir.
kind, any kinds of doubt up to this much, or you have understood everything? Okay. Anyone facing any kinds of doubt related to the luteinizing hormone? Anyone facing? Anyone have any kinds of doubt? Hope the things is too much easy if you are listening it properly, and if you are just look down upon the things properly, then you might easily getting any kinds of answer or giving any kinds of answer, attending any kinds of examination also. That's all are very basic things. You should not do any kinds of master degree or PhD regarding this hormone. Just taking the basic idea regarding this hormone, that will helpful to your biochemistry and anatomy physiology. Same me and everyone understanding. Okay. Now I am moving to the follicle stimulating hormone. That is the last hormone in today's class. Okay. That is a follicle stimulating hormone. See, follicle stimulating hormone. That's basically defining. See, if you are noticing the terminology here, come here, come here the function section. Stimulate defining that the elevated or that will increase whenever the meeting will be ended, just joins the another meeting. Okay, I will give you the link, okay, for the another meeting also. See, stimulating defining that the growth and maturation of the ovarian follicle in the female, understand? So that this hormones name defining the function, follicle defining the follicles, right? And stimulating defining the stimulate, right? And hormone defining the basic function. See, that's basically stimulate the growth and maturation of the ovarian follicle, so that the hormone is follicle stimulating hormone. Understood? And these three hormone all are secreted from pituitary gland. The FSH that is also secreted from the pituitary gland, prolactin that is also secreted from the pituitary gland, okay, and LH that is a luteinizing hormone that is also secreted from the pituitary gland. See, and that's basically help to promote the spermatogenesis. Spermatogenesis means formation of the sperm in male. Okay, by acting the estradiol cell in testes, basically evaluate the function of the testes so that the spermatogenesis are occurring properly. Now I am coming to the purpose. If I am saying about the purpose to access the fertility, I have already told you that to access the fertility and ovarian reserve of the woman. After that, I have already told you that if the hormone are related to the reproductive function, the second function should be the menstruational related, or second purpose should be related to the menstruation cycle. One thing please keep in mind that first function should be for, or first purpose should be in any kinds of hormone infertility. Okay, if the hormone are related to the reproductive system, firstly infertility, and second function should be if it's related to the women, so that second purpose should be gastro, see, menstruational cycle. Okay, menstruational cycle, that should be the second purpose, and third should be the ovarian follicles, as well as the ovary are working properly or not. That's all. These three functions should be common for each and every female reproductive hormone. Understood? To diagnose the condition of the testicular follicle in men. Okay, and I have already told you the cilia chemiluminescence immunoassay, that is the test methodology. After that, if you are noticing here, that is a normal range. Into the follicular phase, that is normal. Into the ovulation phase, that is also peak. Peak means highermost is amount. Peak means completely topmost level. There should not be any kinds of level of the secretion to the particular hormone rather than this one. Peak means completely extreme. Okay, into the ovulation level, there should be peak in level. Okay, after the clinical significance, elevated the FSH hormone become elevated, and which condition become elevated? See, into the menopause condition, into the testicular failure, into the primary ovarian insufficiency, then FSH level become elevated. After that, where become it decreases? Into the hypothalamic or pituitary disorder. If you are noticing every hormone, the decreased level related to the pituitary disorder, right? Decreased level always related to the pituitary disorder, because pituitary gland are not occurring properly, or not doing the function properly, or not doing the actions properly, so that the hormone become decreases. Understood. And Kalman's syndrome, that is also one type of syndrome related to the FSH hormone. After that,